So today we're going to be talking about shortwave diathermy, and we have two units here today. I will not be able to bring the bigger unit into the lab, so I'm going to introduce it today, kind of explain the difference, and then we'll also talk about some of the laws that govern the use of shortwave diathermy. Shortwave falls under the electromagnetic form of energy, which is one of the forms of energy that you guys will find in, I believe it's your 2.2 or 1.2 outline. So the difference between these, the blue unit that you see over here is a very old unit, and when these units were first created and made, they worked very much like the other electrical forms of energy we're going to talk about with TENS or pre-modulated, where you have a unit here and a head here, and the electromagnetic energy flows between the two. So you really need to make sure that you have these adjusted properly and surrounding the body part that you're going to be trying to focus the energy in. And also that we apply some form of cotton towel, or if the person has cotton shirt on or clothing, to absorb some of the moisture, because electromagnetic energy definitely has a tendency to heat up water molecules, and so that will get much warmer than the tissue that we're trying to affect. So with this unit, the energy travels from here to here. With the newer style units, these actually have a coil in the head, and so the energy travels from inside to outside. So rather than these two heads here traveling, energy travels from one to the other, the actual electromagnetic field is created with this. So this is actually one unit over here, and this is another unit over here, and the controls are actually totally separate. So with this unit, we could treat two different body parts if we wanted to. We could treat a shoulder and a low back, or an upper back and a low back. These newer units also, the wavelengths and the forms are much more refined, so they may actually be a little bit more concentrated, the amount of energy that they feel, the amount of warmth. So you also have to take those into account when you're setting up these units. So next we will have a volunteer as a patient, and we will go through the setup of each one of these units. So before we initiate treatment, I always like to, with my patients, at least go back through one more time and make sure that we have covered all of our contraindications or precautions that we might have with the use of any of the modalities that we are attempting to use. So of course with shortwave diathermy, I will always go back and ask the patient, just wanted to remember and reiterate based off my notes, is there any metal anywhere in your body down
Nope.
Through here? Okay. And do you have a pacemaker?
No, I do not.
Okay. And at this point, you haven't had any active cancer? Okay. And you have good sensation through your low back?
Mm-hmm.
Okay, very good. So again, it's never a bad thing to just reiterate any of the precautions or contraindications that you might see with an individual, and before you initiate your treatment.